All right, welcome everyone. I am Barbara Robertson, co-founder of LactaLearning, and I'm joined with my fellow co-founder Nancy Moorbacher. We are here together
Mhm.
down in Sarasota, Florida, where Nancy has her winter place
Mhm.
to avoid the cold.
Yeah.
And tonight we're going to be talking about how to become a lactation consultant. And we're going to go through the entire process and then we'll have time for questions. We'll also talk a little bit about what we offer in terms of the lactation specific education.
Mhm.
So we're going to go ahead and I'm going to share my screen and we'll take a look at what is going on. All right. So we're going to be taking a look at this document and I've sent it out to you. If you don't have it for whatever reason, let me know. You can just email me at Barbara at LactaLearning. And so this is basically, I went through the IBLCE website and pulled out the information I felt was important and I put it in an order that made sense to me. And so this handout doesn't take place of actually confirming with information with IBLCE or guarantee correct information. They do change things frequently. We try to stay on top of it. So again, most of the information comes directly from the IBCLC and America's website. Okay, but I've reorganized it in a way that makes sense to me. All right. So let's start out with what is IBLCE? Actually, let's start out with the idea of not everybody needs to become an IBCLC. Let's start with that. It sounds like many of you are interested in that, but many people don't need to become an IBCLC. IBCLC is like a master's in lactation education, and not everybody needs that to be able to do the work that they want to do. Many people, we offer a 50-hour course, which focuses on those clinical skills, the communication skills. We also offer a comprehensive 95-hour lactation course, and they both offer credentials. And, maybe that's enough for you. Again, not everyone wants to be an IBCLC, but if you're working in a hospital, if you are trying to get insurance coverage, IBCLC is probably the direction that you want to go with. So what is IBLC? Let's start with that. That's the International Board of Lactation Consultant Examiners, and it is the group that actually offers the IBCLC exam, approves lactation specific education, and it's our overseeing, our kind of our oversight body.
Yeah. It awards the credential,
Mhm.
IBCLC.
Right. And then we have ILCA, which is the International Lactation Consultant Association. And then here in the United States, we have the USLCA, which is the United States Lactation Consultant Association. And those are our professional organizations
Right.
for the
And
IBCLC.
they publish our lactation journals.
Exactly. And so an IBCLC is an international board certified lactation consultant. This is a worldwide credential. It's an international credential. And as I said, it really is like a master's degree in lactation. It's kind of the gold standard. And so lots of Nancy and I both IBCLCs ourselves. Not everybody needs to do this, but if you want to, we're going to go through that process. All right, so you need four things before you can apply for the exam. You need prerequisite education in the health sciences. We need lactation specific education, clinical experience in providing care to breastfeeding families. This is where the pathways come in. And then you need to sign an agreement to adhere to
The Code of Professional Conduct.
exactly. Then once you all those
That's the
four
easy
things,
part.
right? That's easy. You click a box, but I
Right.
read it first, be familiar. Once you do all of this, then you can apply for the exam.
Right.
You can apply for the exam is offered twice a year. It's offered in September and it's offered in early April. You will apply for the exam a good 3 to 4 months before you actually take the exam.
Right.
So for instance, I think you had to apply by June 15th to take the exam in September. And you have to apply sometime early January to take the exam in April. So really keep an eye on those dates And be aware that there's that lag time
Right.
between when you apply and when you take the exam. You have to have all your ducks in a row. You have
All
to
your
have
requirements
done before you apply for the
Right.
exam.
Right.
Once you take the exam, you also have a lag time
About 3 months.
of about 3 months before you get your results. We're not in charge of this, but we
Right.
want people to be aware of this because often they aren't.
Right.
All right, so let's look at each of the areas. So prerequisite education in the health sciences. These have got to be from an accredited university. So there's a lot of fly by night kind of higher education that's being offered. Make sure that yours is an accredited university. We've had great success with our students using their local community college, or it cannot be even local because you can take courses online. It's often the cheapest, kind of simplest way, so kind of keep that in mind. You're going to need 8 higher education courses and 6 continuing education topics. There's no time limit for these. These could have been taken 30 years ago, and these are what you need: biology, human anatomy, human physiology. Note, if you take human biology, it triple dips actually for biology, human anatomy, and human physiology. So keep that in mind. It's a tough course, but you can triple dip. You need infant and child growth and development, nutrition, psychology or counseling or communication skills, introduction to research, then finally sociology or cultural sensitivity or cultural anthropology. Again, those are all college level courses. If you are audited, you'll have to provide transcripts.
Right.
So you want to make sure you have those in hand before you apply for the exam. Then you need basic life support, medical documentation, medical terminology, occupational safety and health security for health professionals, professional ethics for health professionals. At LactaLearning, we do offer a professional ethics course that qualifies for this. And then university safety precautions and infection control. Okay, so these are quickies.
Right.
Now, the basic life support, you can do in under an hour. What
Yes.
is the name of the course?
Infantcpr.com.
That's Nancy and I both did that.
We had, that was a requirement for us to recertify, and I found this course online that was very, very simple to do and get the certification. So it did take about an hour.
Now, if you are one of these professions, you grandfather in with the health sciences.
Right. So in other words, if you are one of these in the list, then it's assumed that you already have these courses.
Right. Somebody mentioned they were a dietitian. Somebody mentioned they were a speech pathologist.
Right.
And so they assume that you have this background.
Right. So you would just need to provide your credential and not proof of the courses.
Exactly. This is the trickiest one: the clinical pathway in providing care to breastfeeding families, deciding on which pathway. Pathway 1, this can be a great pathway if you're already collecting clinical hours. So somebody mentioned they were a dietitian and speech pathologist. If you're working with breastfeeding families already in your work, you probably have some clinical hours already. You might be able to find somebody in your field that you could work with and collaborate with, or you can start, seeing these people. I would recommend that you take a 95-hour course first.
Yes.
So that you have that basic information.
Yeah, for pathway 1 too, if you are accumulating hours, you want to make sure they get signed off by whoever's your supervisor.
Right. Doulas frequently use this pathway as well. If you're a doula and you want to use pathway 1, you will keep a log of the family's contact information, how many hours you worked, and what did you work with that family on with lactation. So pathway 1 can be great. Another possibility for pathway 1 is volunteering. And so there are many organizations. There's Breastfeeding USA, Lactation League. In Michigan, we have the Black Mothers Breastfeeding Association.
Right.
Reaching Our Sisters Everywhere, Rose. Right. And so there might be an organization in your area that offers clinical hours through volunteering. Right. So that's something else to consider and to explore.
And again, you'd need to have them signed off by whoever's overseeing the organization.
Right, so pathway one, the clincher there is you need to have 1,000 hours,
Right.
which can feel like, oh my goodness.
Sounds like a lot.
It is a lot, and so if you're doing it through your work, that feels so much better. So again, it could be your current work or volunteer services. It has to be within the past 5 years.
5 years from the
When you
time you
apply for the exam,
Right.
exactly. So pathway one, more hours, but it's a little more flexible. And again, you need someone to sign off on it, either your nurse manager, or if a volunteer organization, somebody that works there, or if you're a doula, again, your families will be your people that are attesting. We're not going to talk about pathway two. That is associated with university. It's not entirely clear what the status of this is, and Nancy and I don't know that much about it.
Well, I think we do have a link of where they
We
can go
do.
to look
To
at
kind of
what
go,
colleges are offering this.
right.
Essentially, they provide all of the health education courses and
No. They just provide the lactation specific
oh, they
education.
do. Okay.
Yes, you have to
Oh,
actually have
interesting.
finished all your science courses
Oh,
before.
did not realize it.
Yeah, you need 300 hours, which sounds really great, but apparently it's not always easy to find. So we don't know much about pathway three, so we're not
Two. Yes.
we're not going to talk about it.
Yeah.
But we will talk about pathway three. This is where you are directly supervised by an IBCLC.
And Barbara and I have both had personal experience with this.
Right. And you need 500 hours. So it's like, ooh, well, that sounds good. On the other hand, though, you have to apply for pathway three.
Right.
You can't start accumulating hours until your application has been approved.
Right. The IBLC needs to approve your mentor or mentors. It's actually a great advantage if you can work with more than one IBCLC.
Absolutely. But you can start with one and you can add more
Yes.
as time goes on. And so again, 500 hours, but they need to be directly under an IBCLC. I have done this for years. As a matter of fact, the 3 people who work with me at the breastfeeding center of Ann Arbor all were my interns.
Yeah, I mentored three women to become IBCLCs as well.
Exactly. So it can be really wonderful and rewarding. And so let's talk though now about how do they find these clinical hours. So again, maybe you're already set up so that you have them available to you. Say you work in labor and delivery, that would be pathway one. You'd have your nurse supervisor sign off on this.
You might, if you worked in a hospital, you might estimate, for example, maybe you spend 20% of your work time helping breastfeeding families. And in that case, you could take 20% of whatever your work hours were and your supervisor would sign off.
Yeah. And so maybe again, you're interested in becoming a volunteer. Pathway three, you need an IBCLC to directly supervise you. And so looking in your local private practices, who's doing this work and do they need some help with that? We have another friend who works in the hospital. Talk a little bit about that.
Yeah, my friend Renee was the director of lactation at a hospital in New York State, and she brought in interns. She did require that they had finished the 95 hours of lactation specific education, and they would come in. Maybe they'd help mothers get set up with a breast pump, put together kits for the mothers. Maybe they'd shadow Renee, and so they were getting their hours that way.
Yeah, so basically you want to look for the people who are interested in lactation in your area.
Right.
They're the ones, networking is going to be really important for this.
Yes.
And so finding out where these meetings are, where they get together. It could be, for instance, in Michigan, we have the Michigan Association of Lactation Consultants, but we also have the Michigan Breastfeeding Network.
Right.
And then in our area, we have the Washtenaw County Breastfeeding Coalition.
Right.
So it's going to be a little bit of legwork for you to just look around.
Yeah.
Where are the people? It could be a hospital is very active in lactation. Maybe they have a support group that you could attend.
Right. Many states, in this meeting, we have all U.S. People, but many states have breastfeeding task forces. Those are often organized by public health. People in the WIC department, and that might be a place where you could get hours as well, volunteering for WIC. So breastfeeding task forces, or for example, in the Chicago area where I'm from, we have the Northern Illinois Lactation Consultant Association, which is the local affiliate of ILCA. So you could look for your local ILCA affiliate and attend meetings. Usually that's a great idea because you can meet up with people. You get an idea pretty quickly if you feel very simpatico with someone and the way they work, and they can get to know you. So that's a really excellent, going to breastfeeding conferences is another way to meet people who are interested in breastfeeding.
Yep. So again, that networking and
Right.
kind of looking around in your area and who's passionate about this, who's interested in it, and getting to know those people.
Yeah, and just to let you know, we recently started a YouTube channel. It's youtube.com/@LactaLearning, and we do have a video on there where we discuss how to find your clinical hours.
Actually, it's going to be posted. Oh, you put it up
I
already.
did put it up. It's there.
Oh, that's right. We
It's
haven't
there.
we haven't posted our podcast yet, but it is up on our YouTube
It
channel.
is. It is on our YouTube channel.
Fabulous. So a lot of different ways to kind of look for those clinical hours. I think that you have to, again, think if we're going to get an IBCLC, this is where the master's degree comes in. It takes time to get all the college courses done. It takes time to get these clinical hours because we want to make sure that, again, if we're having that gold standard, that we've had the training that is needed. As Nancy mentioned, our friend Renee, she wants people to have already had that 95-hour course, and that makes you look more desirable as a candidate. Yeah. The other thing is make sure that you have a resume or a CV ready. I always ask for it because I feel like if you can't do that, I'm probably not interested. So just have that prepared. If somebody's like, well, tell me a little bit about your experience, you can be like, why here, here's
and it doesn't have to be in lactation. Obviously, if you're just getting into the field, we have people in our field who have written books and are very well known who maybe started in different fields. So the fact that you maybe have some college or a degree in another subject, is absolutely fine.
One of my interns, she was actually a research expert, and she was really great at putting together studies and surveys. So one of the things she did was help me put together a survey. And so a lot of different skills can be helpful. And neither Nancy or neither of us are RNs.
No.
So you don't have to be an RN.
You don't have to have a medical background.
And we think that actually having a diverse group of people in the field of lactation makes it stronger.
Yeah.
I have a master's in education. Nancy, you have your background in education, but also working in a pump company and working with a hospital.
Right.
Lots of different.
I've worked in a lot of corporate lactation, private practice. I've worked in a lot of different settings.
Exactly. So again, pathways are the trickiest. I'm sure we'll have some questions about those, but let's continue on. So the education in human lactation and breastfeeding, the lactation specific education, you need 95 hours. 5 hours needs to be on communication, 2 hours needs to be on the WHO code. That's our course has that built in. So that if you do our CCLS course, it does have all of that in 95 hours and everything that you need. This needs to be done 5 years before applying for the exam as well.
Within the 5 years.
Within 5 years. So that and the clinical hours, they want those to be recent.
Right.
Whereas the health education can be farther back. And then again, you sign this agreement. And we do take our code of professional conduct for IBCLCs pretty seriously. We try to really uphold the best practices working with clients, including HIPAA and things like that. So this is an important document. And then, as I said, you get all of this completed, you have it ready, and then you apply for the exam. You only have to provide the documentation if you get audited, but it's totally random as to who gets audited and when and why.
Right.
So really, we very much suggest that you have a folder on your computer that has all of your certificates and all the documentation,
transcripts,
everything that you might need.
Yeah.
All right, the last thing I'm going to do is I'm going to go ahead and show you our CCLS, our Clinical and Communication Lactation Specialist Self-Study. Nancy and I both believe that clinical skills and communication skills are very important.
Yeah.
If you don't know how to talk to people, interact with people in a, respectful, helpful way, it's not going to be a good experience. And so we do focus on those interpersonal skills as well as the clinical skills. One of the things that we did, so
Yeah,
the IBLCE exam is based upon this.
it's a document called the detailed content outline.
Yep.
And it has 7 topic areas. And underneath you see they have subtopics. And there are 116 of these. And so when Barbara and I first met, we did a book group together, and we were discussing with our students that we were thinking of coming up with this course. And one of them suggested, well, if you want to be really helpful, you will structure your course around this detailed content outline. And that's exactly what we did. We managed to get a hold of the one that was coming out for the next year, and that's the one that's still current. And so the course is structured exactly along those lines. So if there's a specific area that you'd like to focus on, that makes it really, really easy to do it. And this is also complete. I mean, every single one of these 116 subtopics are covered. With many other courses, they have, PowerPoint presentations, and it can be very difficult to sort out, which ones cover, which of these topic areas. So this makes it really easy.
So yeah, you can see here it says development nutrition, infant, then 1, feeding behaviors at different ages. Well, here we do with development and nutrition. We're in A, infant, and here feeding behaviors at different ages. And we don't have a ton of PowerPoints. We have some short videos, but we have one of the things you get if you take our course is a PDF of Nancy's book, Breastfeeding Answers.
Right.
And we have all the readings.
So the textbook is actually included with the course, which is another thing that sets us apart.
Yeah, and so it has all the readings for you to do on this subject. We have videos here, and then we have some text.
Right.
So we have short videos, we have infographics, we have podcasts, we have
live discussions.
Live discussions. That's every month. We offer a live discussion,
right,
where you're welcome to join us. If you're taking the CCLS, we record that and we post it.
That's our 95-hour course.
Exactly. We do require that you do 2 assignments. So they're assignments, they're kind of like cumulating activities. We have one on communication skills, one on pain, one on working and breastfeeding. And you would submit those assignments toward the end of your time, once you've covered the material. Don't be afraid of the assignments. They're interesting, and we also feel like they are very informative. They're really, and they're not just fluff.
They help you internalize the information.
Exactly.
So Barbara, with her master's in curriculum development, one of the reasons I was very excited to partner with her is because one of her focuses is on adult education. And so this idea of using these multiple learning formats is a way to help you retain and use the information more effectively than just passively sitting and listening.
Well, and something that surprised Nancy and I is that people, when they were finished with the course, they asked us if they could continue to have access to the course because they're using it as another almost textbook.
Yeah, because so many of the resources that we include in the various lessons are resources that you'll actually use in practice.
Exactly.
So it's not just something you'll watch once and be done with. These are resources you can use again and again.
All right, so that's the basic kind of overview of the process. So this is now your time to ask questions about any of the things that we've discussed. So you can just unmute yourself and we will answer any questions that you have on the materials that we're talking about tonight. So yeah, anything specific? Yeah, Alex, go ahead.
Yeah, I have a couple quick questions. Sorry.
Okay.
Yeah, just picked up from school. Here we are. So we've got kids in the background. Um, I'm wondering that I think what I read online is that the course, the 95-hour course is offered, you've got 2 years to complete it.
No,
Um, sorry?
we don't put a specific time limit.
Yeah,
Okay.
as of now, we don't have a time limit.
Right.
We encourage you to finish it soon, but
Yeah. Yeah.
we know that many
Right.
people have a lot of things going on. So no, we don't have a cutoff date as of now,
Oh,
Alex.
that's great to know. And then the access to the course content, does that still remain open sort of in perpetuity, or is there a timeline
At
on
this
that?
moment in
Right.
time,
Right.
we don't know if that's going to be forever, but at this moment in time,
Yeah.
yes.
We're not kicking people out of the course.
Yeah.
We're allowing them to stay in even after they complete it and use it as a resource.
And
The
then
other
the
thing,
last question I had really quickly, I see it. I see it. It's beautiful sunset. Sorry. Um, the last question that I had was just about the recognition, I guess, of the certification of this course. It's in support of being able to sit the exam, and that's applicable in the United States, obviously, because that's where the course is created. But in Canada, would that still suffice? There's
so
no sort of
this
restriction
is
around that.
this is the thing, Alex. Other than the IBCLC, there's no there's lots of 3-letter and 4-letter kind of lactation certifications out
Mhm.
there. And so Nancy and I we have two, we have a 50-hour certification course, the LCE, and then a 95-hour CCLS. I think the most important thing is that you have taken 95 hours of lactation education.
Right.
I think that's what to focus on. Some people get very excited about initials and
Using that credential and
right, some people don't. And
right.
so depending on what your goals are, Alex, you might start out working as a CCLS, and then your ultimate goal would be to be an IBCLC, but it might be that being a CCLS is enough for you.
Yeah.
The thing that I've noted is the thing that I've noticed is that in Canada, it's like sort of there is no there's IBCLC and that's it in
Right,
terms
there's
of
no
certification.
businesses in Canada that are
Yeah,
offering. Yeah,
there's no sort of lactation counselor
yeah,
certification.
Right.
So I
exactly.
hesitate because I've done the course and I've you know sorry, multitasking. Okay, Charlotte, thank you. Um, I would love to be able to say that I'm a specialist in lactation, but I have to just be very careful of the wording that is used at the
Right.
end of
Exactly.
You can
credential.
show
And I do,
we provide you with a certificate
Mhm.
of
yeah,
completion of the course,
yeah,
in which you
yeah,
can definitely show that you've had the 95 hours.
And we have a
yeah.
practice
Right.
and we have a recertification process.
Right.
So, which is what everybody else does as well. But yeah, it's, 95 Rivers of Lactation Education is great, but it's not, again, that master's degree.
Right.
So if you're going,
That's right, and I think that's quite a distinction. Like you mentioned, it's really the gold standard, and it really provides
Mhm.
people with a lot of confidence in your training. And so
Right.
while
Right.
I might
Right.
be a specialist in pediatric feeding as a speech pathologist, I think it
Mhm.
having that extra credential really sets me apart. So that's why I'd like to go for it.
Yeah.
Right. Right. That
Mhm.
makes sense.
All right. Yeah. Thank you, Alex. Other questions that people have? Ty or Jen? Motorola?
I just want to make sure that I'm understanding correctly.
Sure.
So I, for pathway 3, so I have the college credentials and then the other classes needed after that. So
Mhm.
then like my next steps would be to take the 95
Right.
hour course, and then I would have to get a mentorship lined up and then apply for that through the IBCLC.
Well,
Right.
it would probably take you some time of working with your mentor um,
Okay.
to gain the 500 hours. But once you were finished with that process, then you would be ready to apply.
for the exam,
Okay.
right, for the exam.
but you have to apply for mentorship first.
Right.
Okay.
And,
Yes. we have to apply for that.
Jen, it's also okay to like get started on your 95-hour course and then look for mentors because you
Okay.
have the plan in place.
Right.
Yeah, for sure. I know, I think you mentioned that like showing that you're taking the 95 kind of confirms that we're like committed to
It
moving
does.
forward, right?
I've
So,
probably had 10 people start their mentorship with me that never finished for lots of good reasons. But it
mhm,
does show a level of commitment,
mhm.
and it gives you that knowledge base to
Yeah.
be able to help people. So, which is the goal.
And then, sorry, also said that for the CPR course, you took a course on infantcpr.com.
Yes,
Right.
Oh,
that was
okay. And then, I'm
A
sorry, just
plus.
one last thing. Um, the group in Illinois was called, um,
What's your
Oh, Northern Illinois Lactation Consultant Association. I know there's
okay,
also an Illinois Breastfeeding Task Force that meets in, I believe they meet in Central Illinois. So
okay,
that's through public health, but Northern Illinois Lactation Consultant Association is one, and I think there's actually more than one. So you can look. Does the ILCA website have
USLCA website?
US? Okay, you go to the uslca.org website, and you can find affiliate groups.
Mm-hmm. You're
okay,
state by state.
Yeah,
okay. Thank you so much.
You're
sure.
welcome. Yeah, Ty,
I have a,
Crystal, go ahead. Yeah, go
I have
ahead.
a question.
Mhm.
So my phone cut off in the middle of the part where they talked about CPR and the other classes. But
Okay,
I'm gonna make sure I look. But I'm gonna make sure I look at the YouTube video, that you post on YouTube. But for I know you said CPR, which I already have my CPR, my basic life support. But for the other classes, like the medical terminology, it was like the health,
Right.
the health
So
safety
those,
occupation.
yeah, those,
Would I need? Well, I know medical terminology I would take at college, but with the other classes, would I be able to take in college as well, like college courses for that as
you don't need to
well?
do college courses for those, the 6 continuing ed. You can,
Okay.
yeah, you
they
can
be
just,
online courses.
yeah, they can be online shorter courses.
Right.
So for instance, we offer a 5-hour ethics course that would qualify. So it does, yeah, they're not like big college courses.
Right.
These are
Okay.
short, continuing ed courses.
Okay. All
Okay,
right. Thank
Sure.
you.
yeah. All right, any other questions? Yeah, go ahead.
Hi,
Hi.
my name is Annie, and obviously it shows as Motorola, which
Yeah,
I apologize
no
for.
worries.
Great.
I was
Glad
in
you
a
could make
hurry
it.
to join the meeting, so I didn't see even I thought it was showing just the device that I am connecting
That's
with.
fine.
But I wanted to ask about the mentorship. If the 500 hours mentorship, what is, so let's say through your program, what is the cost of that?
We do not offer mentorship from LactaLearning. This is going to be offered with private practice IBCLCs or through public health or your local hospital.
It needs to be done in person in your local area.
Well, you can
Oh.
have phone support as well.
Right, that's true.
And telehealth.
That's true. That's true.
But yeah, so LactaLearning does not offer the clinical hours. You're going to have to find those elsewhere.
Yeah. Okay. Sorry.
No, that's okay.
Okay.
Yeah,
I'm
the
confused.
clinical hours are complicated.
Yeah.
And
And
we
one
don't
of the things I mentioned is that we do have a new video up on our YouTube channel on where to find clinical hours. So that's youtube.com/@LactaLearning. And you can look for the video where to find clinical hours.
Then we go into that more again.
Right.
Yeah, I understand, and I will check that. I have a lot more than required
Great.
clinical hours, but I don't have the education that it's needed yet. So by the time I will be done with the education, my hours just expired.
Oh dear.
Just this September.
I'm so
Yeah,
sorry.
Yeah. It's
I know.
frustrating.
It is,
Well,
it is.
And so make sure
Um,
that, so if you're doing pathway 3, one of my jobs as your mentor is to like, okay, which college courses do you need to take? Which continuing education classes do you need to take? Which, how's the 95 hours coming? And it's my job to help make sure that you're getting all of this done so that by the time you're done with your clinical hours or your education, that all the ducks are in a row
Mhm.
so that you can go ahead and be ready to apply for the exam.
so to the previous lady who asked about the education, you said that not all of them have to be college courses.
Right.
The
And
6
to me,
continuing, yeah.
There's the health sciences do,
Mm-hmm.
but the continuing education courses do not.
Right.
okay. Okay. Well, that's good. Thank
Yeah.
you. Thank you.
And again, we found really good luck with the local community colleges. Usually the courses are quite good
Mhm.
and they're more affordable. And also community college people, I don't know, it's just a lovely level of education
Mm.
I have found.
Mhm.
So it doesn't
Yeah.
have to be Yale or
No.
Harvard. So
Okay. Well, thank you. That was very informative.
Good.
good, thank you. Okay. All right. Yeah, any other questions before we're done? And we will be going ahead and we will publish this on the YouTube channel again.
Yes.
So that if you're like, wait, what did they say? You can go back or you
Yes.
feel free to email Nancy or I, Nancy@LactaLearning.com, Barbara@LactaLearning.com, and we're here to help support you
Yeah.
in this journey. All right, well, thanks everybody. I'm
Yeah.
going to go ahead and end the
Thank
recording.
you.
Thank you.